One of the most common questions I'm asked is, what do you consider an infant? When it comes to airway obstruction and emergency management, also, who do you consider a child? From what age to what age? Currently, for emergency management, infants are considered from the age of 0 to the age of 12 months old. When it comes to children, we now consider them from 1 year of age all the way up to the age of puberty. We used to say 8 to 9 years old. Now we mainly go by weight. Remember, 55 pounds is your magic number, particularly when speaking of medication. 55 pound is your limit when it comes to what you're determining, mainly because of body mass. So I'll give you guys a quick example. If I happen to have a 10-year-old that is 68 pounds, unfortunately, we're going to treat that child as an adult, mainly because of body mass. But my 50-year-old friend that's in the hospital that is currently 47 pounds, I will now be led by the weight particular standard and protocol of 55 pounds. So always keep that in mind, mainly when you're dealing with dosage and medications. But also when it comes to emergency management, we do go by the weight, particularly when it is time to introduce the compressions. Thanks, everyone. I'm going to get a chance to share as to why children and infants are more prone to airway obstruction. Basically, you want to keep in mind, for children and infants, the airway is known to be a lot smaller. And because of this, it's easier for solids and thick mucus to get lodged in the airway. Separate to all of this, I just wanted to also sit down and let everybody know children love to put things in their mouth because it happens to be a soothing type of mechanism for many of those children and infants that are teething or might be losing a tooth. Airway obstruction. How can I identify an airway obstruction for a child or infant, particularly a full blockage or what we know as severe airway obstruction? You want to make sure you're inspecting the infant's face or child's face. Generally, for light-skinned infants, you want to make sure if you see anything in regards to the symptoms known as cyanosis, meaning the area of the face will be bluish. For those infants or children with dark skin, those of us that are Caribbean babies or dark-skinned babies, you